to the West Air Force deployment presentation on a comparative analysis of the Ghanaian healthcare system, global health and states healthcare. My name is Daniel Nwoke, and I'll start with the background of the country we are looking at. That's Ghana. Ghana is a developing nation that is surrounded by nations of Burkina Faso, Cote d'Ivoire, Nigeria. It has about 32.1 million persons who call it home, and 4 out of 10 Ghanaian citizens are currently living in poverty. Ghana is one of the least developed nations in the world, let's put it that way, and is ranked 131 out of 177 nations, according to the 2020 Human Index Development statistics. And Ghana's economy has performed relatively poor for most of the time since independence in 1957, and that's despite its relatively riches in minerals and other natural resources. The population growth rate is increasing and is currently in the world is ranked at 40. The birth rates are 30.8 births per. Young density is about 0.1 when you compare them to about 1,000 of the population. Healthcare challenges. The problem with Ghana is that instead of 15% funding allocation that it has promised in previous years from the government only spends about 5% of its healthcare on that. And the lack of contemporary facilities and the country's undeveloped healthcare infrastructure are two of Ghana's critical and urgent. 5.5% live births per woman and 2.2 when it comes to the world. And Ghana's state of healthcare infrastructure is at an all-time low. Cities are struggling with a persistent issue of aging, inadequate facility maintenance, weak and inadequate infrastructures as well. When it comes to COVID, the first case of COVID was confirmed in Ghana in March 12, 2020. And malaria is one of the most popular endemic in Ghana with seasonal variations. And when you compare the developing countries such as Ghana and United States, there are a whole lot of factors that are prevalent as to why these are the major top 10 challenges in Ghana. America is mostly having to deal with cardiovascular diseases, gastrointestinal diseases, diabetes, cancer, and hypertension at an all-time. Why Ghana is having to deal mostly with malaria, stroke, poor healthcare infrastructures, neonatal disorders, HIV, and tuberculosis. Not insurance mechanism. In the United States, we are using mostly a multi-payer system, which is most used to finance healthcare. There are other government plans such as Medicaid and Medicare, and government subsidized plans like for private employer-based insurances. And pay some deductibles, have a cost share of the maximum amount. Then Medicare and Medicaid accessibility and affordable care coverages. The health insurance system structure in the United States is continually creating a burden for many individuals, which has led to about 27.5 million persons being uninsured as at 2022. And to the introduction of the public insurance system in Ghana, which has taken over the cash and carry healthcare system in 2023, Ghana is one of the most developed nations in Africa in terms of the Ghanaian government has also established the Ghanaian National Health Insurance Scheme, which is concentrated on meeting local requirements, trying to make sure that the system takes care of its population. The Ghana Health Insurance Scheme has been able to increase at least coverage for most of this funding comes from the National Health Insurance Levy, which accounts for 70%. Social Security and National Insurance Trust account 17% of the funding, and premiums account for 4, while other sources like donations account for 8%. That practically means that in Ghana, most people have to pay out of pocket 60% of the time they go to healthcare facilities, and even the states are very deplorable. While in the United States, we have private insurances and other system of payment that is able to cover healthcare costs. When you look at the training of health professionals, Ghana and USA has similar training. The preventative care and primary care are mostly by doctor of medicines, doctor of osteopathic medicines, and assistant nurse practitioners, and pharmacists, and the training systems are similar. In Ghana, for you to become a doctor, go through pre-med medical school, become a house officer. Some call it registers, and then before you are in residency and fellowship, and after medical school, you tend to practice in Ghana. And if for through nursing school for 4 years, able to get a license to practice as a nurse. While in the United States, for you to be a physician, you have to go through school. And in medical school is where you complete the United States medical licensing exams, go through residency, go through fellowship. Residency lasts about 3 to 5 years, depending on the specialty, years plus, depending on the specialty. You go through college nursing prerequisite program. America does the program where you can go through the CNA to LPN and then transition to RN in between. But in Ghana, it has to be a 4 years nursing program. Same thing with the pharmacy school. And when you look at the quality of healthcare in these two countries, you're looking at the health expenditure and health policies that this country have. I've listed out some of the healthcare expenditures that are affecting them, like environmental factors, individual factors, maternal and child health factors, and the health system. These factors lead to what uh, healthcare in the United States is ranked one of the lowest when it comes to development. And patient satisfaction is also used to measure the quality of healthcare. America is projected to hit about 6.2 trillion by 2020 health expenditure. Yet, we are not able to have quality healthcare and quality healthcare satisfaction among patients. Patient satisfaction affects clinical outcomes, patient retention, and medical malpractice claims, which are at an all-time high right now in America. And when you look at for that Ghana, when it comes to socioeconomic, see that United States would definitely have a higher care satisfaction because United States has more fundings and more resources afforded to it. Ghana on its own has resources. Come on, look at a typical operating room in the United States contain a variety of medical equipment, overhead lights, scopes, scalpel, and surgical tools, right? And Americans are at least receiving at least 75% healthcare in Ghana. Most of these hospitals have poor infrastructures, don't even have theaters because of poor health systems funding and more healthcare providers needing to be trained to at least boost the quality of healthcare infrastructure organizations. This funding don't come, it now trickles down issues that come from healthcare beliefs, which impacts positive quality of healthcare. In the United States, you could see that there is access to healthcare, which takes about 4 to 6 months for most times for people to get appropriate medical care. On non-substantial changes that the systems have, the national health insurance system that was launched by Ghana in 2013 has actually improved accessibility to healthcare. It has helped in expanding access to uh, basic healthcare services and upgrading the nation's healthcare system. Also, the creation of the roadmap for Ghana's universal healthcare sector, getting some of the circumstances. The roadmap has outlined 6 interventions IS has developed aimed at consolidating and optimizing basic essential services, managing clinical and public health emergencies as well. And some of these interventions, especially when you look at the infant focus, has accessibility to healthcare for Ghanaian citizens. And before 2000, it was estimated that about 540 to 650 mothers die of out of 100,000 live births faced with maternal mortalities. But because of the maternal healthcare policies and the Ghana Child Health Policy, as well as the Child Health Strategy, these numbers have been reduced and there's been a substantial change. Comparing this to the American changes, you could see that America is expanding and improving the Affordable Care Act coverage so that people all over the United States are able to access healthcare. The Congress has passed so many bills which has reformed healthcare delivery system, and expanding rural community healthcare centers has been one of the major achievements of the United States healthcare system, meaning that people in rural areas are able to access healthcare like never before, and making it easy for people within poverty brackets to still access healthcare despite financial constraints. What are the current threats that this into the United States on analysis level? You could see that inadequate knowledge, especially when it comes and some of these hospitals are in deplorable states, and there's issues of medical negligence. Many people are losing their loved ones because of this phenomenon. There's something called the no bed syndrome in Ghana. This is because it has caused thousands of deaths across Ghanaian healthcare facilities, and is a long-standing problem, very known in the Greater Accra region because of in the hospitals. And poor preventative malaria cares have been an issue. Diabetes and stroke has been a major issue, as well as the doctor-patient ratio. When you compare to the United States, you could see that obesity is one of our major problems. There's lack of transparency in healthcare, high cost of care, and nursing and physician shortages, as well as racial disparities are one of the main issues that are threatening the healthcare system in America. These things can